Relative positions help you identify parts and pieces of the body. Number 1 is dorsal. So dorsal is going to be towards the back. So towards the back is dorsal. Opposite of that would be ventral. So towards the belly would be ventral. If I have 2 dots, I have a green and a red dot. The green dot is more dorsal and the red dot is more ventral. So if those were 2 lumps on the horse and we needed to do surgery and remove one of those lumps, and we needed to remove the red one, we would say remove the ventral lump. Three and 4, cranial and caudal. So cranial is more towards the head, caudal is more towards the back end. If we look up at the nose here, we also have caudal, but then towards the tip of the nose is rostral. So towards the tip of the nose would be more rostral. Towards the back of the head is going to be more caudal. This is more common on animals as they have kind of a longer snout than humans. If we look at the legs, we have cranial and caudal at the top here. But then towards the feet, we have different wording. We have palmar in the front, and then we have plantar in the back. So the palm of your hand is palmar, and that's an AR, and the bottom of your foot is plantar. You might have heard of plantar warts. Plantar warts are warts found on the plantar surface, so that would be on the bottom of the foot. So continuing with the horse, number 11 and, continuing with some relative positions, we have superficial and deep. Superficial would be towards the outer surface of the body, and deep would be more towards the core. So if we're thinking of a paper cut is superficial. It's on the outer surface of the body. If I was to do heart surgery, I would need to make a deep cut. So stabbing you in the chest with a knife is going to make a deep cut. Slicing you with a piece of paper is going to make a superficial cut. And then we have medial and lateral. Medial means towards the midline. So if I drew a line down the center of my body, the closer I am to that line, I'd be more medial. The further away, I would be lateral. So if you took a look at a shirt with buttons, the buttons would be medial to the pocket, which would be lateral. So more towards the away from that midline is going to be lateral, closer to that midline is medial. Then we have proximal and distal. Proximal is closer to the body, distal is more distant from the body. So your fingers are distal to your elbow. Your elbow is proximal to your fingers. Your elbow is closer to the body, so it's proximal to the fingers, and the fingers are more distant, so they are more distal to the elbow. When we're looking at humans, we tend to use, because we are upright, we tend to use different words. Towards the head is going to be superior, towards the feet is going to be inferior. One of the major veins in your body is the vena cava, and you have 2, one coming from the head being the superior vena cava, and one coming from the feet being the inferior vena cava. And then if you're looking more towards the front side, it would be anterior, and towards the back, it'd be posterior. So you have your ACL. Your ACL would be the anterior cruciate ligament. So this is going to be the ligament in your knee that's in the front because it's anterior. We can look at planes of the body. So this is basically where we make a cut. When you're doing things like X-ray or MRI, knowing the plane it's cut on is very important because you need to know how is that picture being taken, what kind of slice is being made. Here we have 2 different ones. We have transverse plane. Transverse I like to think is cutting off your head. So if you're going to basically take this plane, cut your head off and look down in, that would be a transverse plane. So if you were to cut your arm here, that would be a transverse plane if you were to look down at that cut. A frontal plane would be going in this direction. So it would be basically peeling the front away from your back. If you peeled that away, that's going to be a frontal plane. Then we have planes going this way. If you cut yourself down the middle this way and peeled left from right, that would be the medial plane. And then if you did off-center from that, kind of took a little bit off to the side, those are sagittal planes. So your median plane is considered a sagittal plane, but because it's in the middle, we have a special name for it, median plane. So sagittal planes are going in this direction, frontal planes in this direction, transverse in this direction, so looking at this x-ray here, you are kind of cutting down the middle. So this is a frontal plane of the legs. Looking at this picture, it's to the side, so it's kind of on this plane. So this could be a sagittal or medial plane. Here, we're looking down in the abdominal cavity, so this is if we basically cut the stomach and look down into the body, so this is going to be a transverse plane. There are several words that we can use to identify different parts of the body. So if we were talking about something that had to do with your axillary area, so if you had a freckle in your axillary area, you're going to have a freckle in your armpit area. So these words help us locate different parts of the body. Knowing these words will make it very easy later on in anatomy when we're looking at different parts, and you can then kind of use the prefixes and suffixes of different words to know where these parts and pieces are. So if you had an umbilical hernia, you have a hernia in the umbilical area or the stomach kind of near your belly button area. If you have carpal tunnel syndrome, then you have a nerve problem in the carpal area, which is your wrist. So knowing these areas will help you know different parts and pieces later on down the line. Here we can divide into 4 different regions. We have the upper right quadrant, the upper left quadrant, the lower left quadrant, and the lower right quadrant. We can break it down a little bit further into 9 sections. If we look at the middle, it's umbilical. If we go below the umbilical, it'd be hypogastric. And hypogastric, hypo means below, gastric means stomach, so below the stomach. Above the umbilical is the epigastric. Epi means around, gastric means stomach, so it's around the stomach area. Over to the right, remember this is right and this is left, so if you were to hold this picture up towards you, that would be your right side and your left side, so it's opposite when it's down on the paper. This is going to be the right hypochondriac here. Hypo means below, chondriac means rib, so it means below the rib. And hypochondriac is also over here. Then here is the lumbar. So that's going to be the right lumbar. This is going to be the left lumbar. This is about the region of your lumbar vertebrae. And then at the bottom is iliac. Iliac is also over there. So you have the right and left iliac. Iliac is named for the part of the hip.